lot. All right, so we're talking about just going around routes of drug administration this evening. So start from these ones, from like the simple ones to like complex ones. So the first one I'll be starting with is inhalational route of drug administration. So to inhale, many people just have like a wrong understanding of inhalation. They feel like if somebody's inhaling, it's only through the nose. No, even when you block your nose, you can literally breathe with your mouth, just that it's uncomfortable. So inhalation can be through the nose or through the mouth. So inhalational route of drug administration, we say that it actually involves delivering medications directly into the respiratory system. Okay, so you are using inhalational devices like nebulizers, metered dose inhalers, and also sometimes it's dry powder. Okay, so we said that this method is primarily used for what? Respiratory conditions mainly, right? So somebody has upper respiratory tract infections, lower respiratory tract infections. You want to basically deliver the medication directly to the system that is affected. Okay, so it can also be employed for systemic drug delivery in some cases. It mustn't be only through the respiratory system. So advantages is there's a direct delivery, so it targets the lungs directly. That's mostly in respiratory conditions, right? So making it effective for treating conditions like asthma, chronic obstructive pulmonary disease, and some other pulmonary diseases. A lot of them. We'll be talking about upper respiratory tract infections in surgery. We'll talk about that more. Then also there's a rapid onset, so it provides fast relief as the drug is absorbed quickly into the bloodstream. There's reduced systemic effects because you are basically targeting the respiratory system, so there's reduced systemic toxicity. You understand? So it bypasses the first pass effect that if you take it through the oral route, you have to actually go through the first pass effect first. So disadvantages is patient technique matters. So it requires proper inhalational technique, so you have to be monitoring the patient, unlike the oral route that you just leave the patient to actually take care of it. Device variability, so there are different inhalers having varying efficiencies affecting the treatment options or outcomes. So there's a potential for local irritation. So some drugs, if they get so much in that particular respiratory system, they can actually throat irritation, all right, cause some one or two adverse effects. So you can't use it to treat all conditions. It's mostly limited to treating respiratory conditions. You understand? So that's just it for inhalational routes of drug administration.